Hello, my name is Sabero Gonzalez. Me, Megan, and Gloria are going to be presenting our PowerPoint presentation on coronary artery disease. Coronary artery disease, also known as heart disease, is when the heart's arteries are damaged. The damage to the coronary arteries is usually due to plaque buildup causing narrowing or blockage. This causes impaired blood flow to the heart. When the heart cannot effectively pump blood because of diseased arteries, there will not be adequate perfusion to the tissues and organs which are needed for survival. Coronary artery disease is the largest killer of Americans of all genders and ethnic groups. The number one cause of permanent early life disability in the world, and every 85 seconds a person will die from coronary artery disease. Coronary artery disease includes acute coronary syndromes, such as myocardial infarctions and unstable angina, as well as chronic stable angina. Angina can be described as pain felt in the chest due to temporary inadequate blood flow and inability to meet the heart's need for oxygen. Chronic stable angina is predictable and often results from exertion or emotional stress. Acute coronary syndrome describes a sudden blockage of blood flow to the heart, such as unstable angina or a heart attack. It is believed this is caused by plaque breakoff, resulting in a clot that blocks off the artery. So right here, you can see the plaque buildup, and it's blocking the artery right here. Signs and symptoms. Coronary artery disease not initially have symptoms and can go unrecognized for long periods of time. The first signs of coronary artery disease often occur when there is a heart problem, such as angina or myocardial infarction. It is important to assess patients with chest pain thoroughly and quickly to identify the source. Signs of angina include chest pain or discomfort that radiates to the left arm. This usually lasts less than 15 minutes and follows exertion or stress. Angina pain is usually relieved using nitroglycerin. Signs and symptoms of myocardial infarction include substernal chest pain or pressure that radiates to the left arm, pain in the jaw, shoulder, back, and abdomen, pain that occurs without a cause, typically in the morning, pain lasting 30 minutes or more, nausea, vomiting, shortness of breath, feelings of anxiety or impending doom, and epic gastric distress. It is also possible to have multiple of the other signs of myocardial infarction without chest pain, leading to the myocardial infarction going unnoticed until it is too late. Recognizing and treating the signs and symptoms of myocardial infarction is important in order to receive a positive outcome for the patient and to prevent death.
Some causes of and risk factors include atherosclerosis, hypertension, hyperlipidemia, and diabetes mellitus. Modifiable factors include smoking, unhealthy diet, and a sedentary lifestyle. Non-modifiable factors include age and gender, such as men over 45 and women over 55, ethnicity, such as being African American, Asian, Native, or Hawaiian American, and genetics, such as familial hypercholesterolemia. Diagnosis is done in various ways. We will be checking for abnormal vital signs and heart sounds, such as an S3 gallop. We'll be doing blood tests, such as troponin levels. We'll be doing some imaging tests, such as the 12-lead EKG, computer tomography, coronary angiography, stress echocardiography, single protein emission computerized tomography as necessary. And some procedures we can do are invasive coronary angiogram and cardiac catheterization. Treatment and intervention goals. For this type of patient, we want to do early detection and intervention, teaching patients good lifestyle habits, early screening for risk factors, treating underlying diseases such as hyperlipidemia and diabetes. We also want to slow the growth of plaque, preventing clots, and relieve symptoms. Medication therapy, such as morphine, oxygen, nitroglycerin, and aspirin. And we would want to assess for at-home medications such as Viagra, which is contraindicated with nitroglycerin. Reduce risk of further complications and severe blockage. So down in figure 8, we'll see a percutaneous coronary intervention, PCI. And on figure 9, we can see we have the coronary artery bypass graft.
For patient and family education, the type of teaching needed depends on the treatment plan or the type of procedure the patient has received. A teaching plan often includes education about the normal anatomy and physiology of the heart, the pathophysiology of coronary artery disease, including angina or a myocardial infarction, risk factor modification, such as stopping smoking, starting a heart healthy diet, reducing salt intake, beginning an exercise program, or the management of comorbidities such as diabetes, hypertension, and obesity. You're going to educate the patient on medications such as cardiac medications like aspirin, beta blockers, statins, or nitrates that they may be discharged with, and when to seek medical assistance in an emergency. You're going to teach patients healing from a myocardial infarction that it usually takes between 6 to 8 weeks to heal. However, upper body exercise needs to be limited for several months. And then patients who had a coronary artery bypass graft are going to require post-operative education on incision care and graft site care. They should be educated on signs and symptoms of infection, the use of compression stockings, and to elevate the surgical limb when sitting down. Next. Continuing education, you're going to patient to express their understanding of the disease and to clarify misconceptions if needed. You're going to evaluate their understanding of prevention and treatment options, including their medications and possible drug-to-drug interactions. You can also print and provide teaching materials. It's important to understand that patients may be in denial, be anxious, fearful, angry, or may fall into a depression. They may need to see a psychologist or social worker. Patients will also need to follow up with a cardiologist and be referred to a nutritionist. Next. For the first NCLEX style question, a 50-year-old male patient comes to the ER with complaints of continued chest pain radiating to the left arm. He expresses having taken the recommended 3 doses of nitroglycerin every 5 minutes without relief and denies any stress or overexertion previous to the pain attack. The patient begins to feel dizzy. What steps should the nurse take first? 1. Prepare the patient for a cardiac catheterization. 2. Draw blood for troponin labs. 3. Complete an ECG stat. And 4. Provide patient teaching in regards to differences between angina and MI. And the answer is complete an ECG stat. The next NCLEX style question. In teaching the patient about drug-to-drug interactions, which medication will you point out as a contraindication for nitroglycerin? 1. Metoprolol. 2. Sildenafil. 3. Aspirin. 4. Morphine. And the answer for that is sildenafil. And then for the third NCLEX style question, which member of the community is at highest risk for developing coronary artery disease? A. A 50-year-old male with elevated high-density lipid levels and claims he exercises 3 times a week. B. A 38-year-old female with controlled type 2 diabetes. C. A 60-year-old vegetarian male who leads a sedentary lifestyle. Or D, a 40-year-old male with a high-stress job who eats fast food 4 times a week. And the answer is D, a 40-year-old male with a high-stress job who eats fast food 4 times a week. Next. And that concludes our presentation. Here's a list of our references, and thank you for listening.